My name is Dr. Oliver Brooks. I'm boarded in pediatrics. I'm a clinical professor of pediatrics at Charles R. Drew University of Medicine in South Los Angeles. And I was the chief medical officer and chief executive officer for a time at Watts Healthcare Corporation, a federally qualified health center in South Los Angeles. There are certain fears that I do hear from the community. In my practice, I practice with the majority Latinx or African American community. So related to the African American community, there were concerns regarding, are these vaccines safe and do they work? As a Black doctor, my role, my goal, my duty is to ensure my patients have the highest degree of health. So as it relates to these concerns that Black families may have, you have to appeal to their heart and their brain and their head. I have studied. I know what I'm doing. I went to school and I practiced for 30 years. You may not trust the system, but you can trust me. I've done the research and I have the knowledge. The COVID vaccine, both the Moderna and the Pfizer, had approximately 12% African Americans in the study, and about the same percent of Latinx. So a quarter of the patients were Black and Latina. So that's the other thing that we were, there's a concern often I get, which I didn't mention, those drugs were never tested on Blacks. So these vaccines were tested in the clinical studies on Blacks and Latinos. And so you can feel comfortable with getting yourself vaccinated. COVID-19 is a deadly disease. If you all remember in the beginning, we were deathly afraid of it. If you got COVID, you had a 50% chance of dying, maybe less than that, maybe more than that. But you saw hospitals piled with bodies. The morgue couldn't hold all the bodies of those that died from COVID. With the vaccine, we've seen probably 90% drop off in the death rate. So just the only thing we did differently with COVID was start vaccinating people. Nothing else happened. The virus mutated, but it mutated, that's bad. So other than that, you can just look at the benefit. On the general side of vaccines, other than safe drinking water, vaccines are the number 2 public health advance of the 20th century, which ended in 2000. Note now, the WHO, who made that determination, WHO, World Health Organization, now saying that vaccine hesitancy is one of the 10 major threats to public health here in the 21st century. One thing I also found that, at least here in California, when the vaccine was relatively scarce, it was in certain areas where other people of other ilk would rarely dare to tread. But we had people coming down from these wealthy areas down into the hood to get vaccinated. So quite frankly, I said, well, you look who's coming here to get your vaccine. They're coming into your neighborhood to get the vaccine that was put aside for you. And that also seemed to be somewhat compelling during the early days and middle days of COVID. Lastly is that, especially in our community, we have the highest degree of things that are poor health outcomes: diabetes, hypertension, liver disease, chronic kidney disease, and the lowest of good things like normal blood pressure. So putting COVID on top of these conditions means higher death rates all around. So we as a community have a vested interest in ensuring that our people, not just our families or ourselves, are vaccinated.